Today we would like to present Take Off and Travel with Diabetes, your guide to reaching your destination via air travel. Traveling can be stressful between booking flights and trying to remember to pack everything, but these tips can make your traveling experience more pleasurable. In this video, we hope to provide you with 5 helpful tips to remember while traveling. Tip number 1, get documentation. Before you travel, it's important to make sure you have documentation from your doctor stating that you have diabetes, as well as obtaining any copies of prescriptions from your pharmacy of the medications you'll be taking on your travels. In addition, make sure all medications have proper labeling and that they match the name printed on your ticket. Making sure to take these steps will ease your way through TSA at security checkpoints. Tip number 2, pack all of your diabetes supplies in your carry-on luggage. Checked luggage is often exposed to extreme temperatures which can damage both insulin and glucometers. However, there's no need to panic if your insulin cannot be refrigerated on the flight, since most insulin will last 28 days at room temperature. While carrying your insulin, keeping it cool is not a bad idea. However, just make sure that you're not using a freezer pack, as this can be just as detrimental as extreme heat. If you're unable to fit all of your supplies in your carry-on and you end up putting them in your checked luggage, be sure to check your insulin for cloudiness and crystallization when you arrive at your destination. If either of these are present, the insulin should be discarded and new vials should be obtained as soon as possible. Tip number 3, try to stick to your normal routine. Traveling can often lead to delays in your normal routine, whether it be from a delayed flight or having to get up early to get to your destination on time. Make sure that you're always prepared with extra supplies and snacks in case you happen to experience hypoglycemia or a low blood sugar. Extra supplies to keep on hand would be medications, whether they be oral or insulin, a glucometer, lancets or lancing device, test strips, non-diet soda, crackers or other snacks, and glucose tabs. Tip number 4, remember to consider time zone changes. When you fly east, you lose time, so you may need less insulin. However, when you fly west, you gain time, potentially requiring more insulin. If you wear an insulin pump, be sure to adjust your pump to reflect the change in the time zone. Tip number 5, tell others that you have diabetes. Oftentimes we assume that people know about our medical conditions, but it's important to remember that this is often not the case. Informing others, especially those that you're traveling with, that you have diabetes can help ease your travel burdens. It can also be vital in case an emergency should arise. Wherever your destination may be, getting there with diabetes doesn't have to be a hassle. With planning and preparation, you'll be relaxing in no time. We hope this video has provided you with some insight into things to consider when planning your next trip. Bon voyage!